Hello, I'm Kelsey Caps, and this is going to be my patient Yolanda Bounds. She is my mother. I would start by performing hand hygiene and putting on clean gloves, identifying myself and identifying my patient, as well as confirming the patient's allergies, presenting medical issues, and past medical history. In this case, my patient takes no medications, has no known allergies, no past medical history, and no presenting issues. She's simply in for a physical assessment. Since the first video we did confirm the first half of the assessment, I'm only going to be doing a select part of this assessment. First, I'm going to start with a musculoskeletal assessment, and I'd assess by inspecting her upper and lower joints and extremities. I'd be assessing muscle strength, size, for any deformities, atrophy. I'd also assess the skin for lumps, bumps, bruises, edema, and ecchymosis. So assessing her upper extremities, they appear equal in equal strength, size of the muscles, no atrophy noted, lumps, bumps, bruises, edema, ecchymosis. I do the same with her legs. And you can't see it because of the camera, but I would do the same for the lower extremities. Then I would palpate for any deformities of the joints. I would start with her hands. And while I'm doing so, I'd ask if she had any tenderness and pain. Do you have any tenderness or pain?
No.
I'd do the same with her wrists, her elbows, her knees, her ankles, and her feet. After doing this, then I would assess the range of motion of her neck, upper extremities, lower spine, as well as inspect and palpate her spine. So to assess the range of motion of her neck, first can I have you turn your head side to side? Do you experience any difficulties or pain?
No.
Head up and down. And can you rotate your head? Do you experience any difficulties, pain?
No.
While doing so. Then I'm going to have you shrug your shoulders. Move your shoulders in a circle. Move your arms side to side like so. Wrists. And can you move your fingers freely? Did you experience any difficulties while doing so?
No.
Pain?
No.
Okay. Then I'd have her do the same with her lower extremities. Have her move her leg side to side. And rotate her leg in a circle, each leg. She's able to move her knees back and forth. Do the same with your ankles. And can you move your toes freely?
Yes.
Do you have any pain or tenderness or difficulties while doing so?
No.
Okay, then I would assess by looking at her spine. Ideally, she would be in a hospital gown where I could see the spine completely. I would have her bend over and check to make sure that the spine is aligned. There's no curvatures. Do you have any pain or tenderness?
No.
And I would palpate the spine and the prominent landmarks of her spine. Then I would move on to assessment of the thorax and lungs, since everything is within normal limits. First, I would assess. Ideally, she would be in a hospital gown. I would assess the thorax for any abnormalities, lumps, bumps, bruises, edema, ecchymosis. Then I would go ahead and assess for tactile firmament. First, I'm going to start this posteriorly. Every time you feel my hand touch you like this, I want you to say 99. Okay?
Yep. 99. 99. 99. 99. 99. 99.
Okay, I'm going to do it in the front.
99. 99. 99. 99. 99.
Okay, hold your arms out. I'm going to do it here. Do it again.
99. 99. 99. 99.
Okay, and that test assesses for any abnormalities such as pneumonia in the lung fields. The tactile firmament test came back within normal limits. Now I'm going to percuss her posterior lung fields. You're going to feel me tap my finger on your shoulders, the middle of your back, and across the back of your back. I just need you just to breathe normally while I do so. percussion test came back within normal limits. Now I'm going to auscultate her long sounds posteriorly and anteriorly. Every time you feel my stethoscope, I need you to take a deep breath. Okay, lift up your arm. Other side. Okay, I'm just going to listen to your lungs from the front. Okay, and all lobes appear clear and her effort of breathing is effortless. Are you experiencing any pain while breathing?
No.
Okay, now I'm going to move on to the cardiac assessment. First, I would start by assessing her apical pulse. Ideally, she would be able to lay supine while doing so I could hear the pulse more clearly. I would assess the apical pulse for a full 1 minute. Ideally, a whole minute would have passed, and I'd be able to project her pulse rate from her apical pulse. For the purposes of this video, we are going to say that the pulse is 80, which is within normal limits. Next, I'm going to listen to her heart sounds for any abnormalities such as murmurs, regurgitation. The first heart sound I'm going to listen to is the aortic, which is found at the second intercostal space, right sternal border. No abnormalities are heard. Then I'm going to move on to the pulmonic, which is the second intercostal space, left sternal border. No abnormalities are heard. The third intercostal space, left sternal border, is Erb's point. And no abnormalities are heard. Then the fourth or fifth intercostal space on the left side is the tricuspid. And then the fifth intercostal space, mid-clavicular line, is the mitral valve. And all of those are within normal limits. Then I go on and inspect her abdomen for any lumps, bumps, bruises, ecchymosis, or edema, and none are noted. And I move on to listening to her bowel sounds in all 4 quadrants. In the left upper quadrant, bowel sounds are normal active. Left lower quadrant, bowel sounds are normal active. Right lower quadrant, bowel sounds are hypoactive. And right upper quadrant, bowel sounds are normal active, which are all within normal limits. Then I'm going to auscultate the major arteries and veins of her abdomen. First is the aorta, which is located just below the xiphoid process. Then the renal on each side of the aorta. The iliac on each side and below the umbilical. And the femoral, which is each side of the groin. All are within normal limits. Then ideally she would be laying supine, and I would feel her abdomen for any lumps, bumps, tenderness, any pain.
No.
With light touch, then I'd utilize deep touch. No abnormalities are felt. Any pain?
No.
Okay. Then I'd move on to the peripheral vascular assessment, and I'd assess for abnormalities of the veins, such as phlebitis, edema, spidery angiomas, any swelling, redness of the calves, extremities. I'd inspect the upper extremities as well as the lower. Then I would assess the radial and brachial pulses bilaterally. So radial, I'm assessing for strength and regularity. Both are regular, both are strong. It would be rated as a +2. And I would assess the brachials. Both sides are regular and strong. I would say +2. Then moving on to further assess hand circulation to check for blockages in the renal and ulnar arteries, I would perform the Allen test. First, I'm going to have you hold out your hand. I want you to squeeze it back and forth together several times and then hold it very tightly. Okay, I'm going to occlude the renal and ulnar arteries. I'm going to have you release your hand. Okay, and I'm going to release the radial and the hand pinked up so there is no occlusion in the radial artery. Now we're going to do the same thing. On the other hand, we'll do it with the ulnar. Okay, now I'm going to release the ulnar artery. Go ahead and open up your hand. And the hand pinked up. There is no occlusion in the ulnar artery. Next, I would assess her pedal, tibial, and popliteal pulses bilaterally. You can't see them from this video, but assessing the pedal on the top of the foot, we're going to say that is a +1, which is still within normal limits, and the pulse is regular bilaterally. We're going to do posterior tibial. Bilaterally, both sides are +1, which is still within normal limits, and regular. And then the popliteal, we're going to assess bilaterally. Going to assess a +1, which is still within normal limits, regular, bilaterally. Then I would assess the capillary refill on her upper extremities bilaterally as well as her lower extremities. I do this by squeezing her nails and assessing the time that it takes for the pinkness to come back after blanching. Normal is less than 2 seconds. This checks for adequate perfusion to the tissues as well as dehydration. On 1000, the hands pinked up again after blanching within 2 seconds, and I would do the same for her toes bilaterally. And both sides are within normal limits on her lower extremities. Then I would move on to the neuro assessment. The neuro assessment I'm going to start with, I'm going to check her cranial nerve 1, which is olfactory, and her sense of smell. Have you noticed any difficulties with sense of smell, detecting smells?
No.
Any changes?
I can smell everything.
Okay. Then we'd move on to checking her cranial nerve 5, which is the trigeminal nerve, and this is tested by touching her face. Can you feel this?
Yeah.
Okay. Cranial nerve 5 is intact. Then we're going to move on to check cranial nerve 7, which is her facial nerve. First, I want you to raise your eyebrows like you're very excited. Don't let me push them down. Okay, squeeze your eyes shut really tight. Don't let me open them up. Okay, puff out your cheeks. Don't let me push them in. Okay, grind your teeth like, okay, and make a pursed lip. Okay, all tests are symmetrical, indicating that the facial nerve is intact. Moving on to cranial nerve 9 is the glossopharyngeal nerve. I'm not going to assess this because my patient has no difficulties swallowing, but in the case I did not know this patient, I would ask, do you have any difficulty swallowing? And then further assess for the gag reflex to check the intactness of cranial nerve 9. Cranial nerve 10 is the vagus nerve, and my patient is able to talk and swallow fine, so I know the cranial nerve 10, the vagus nerve, is intact. The cranial nerve 11 is the accessory muscles, and while assessing the range of motion and strength of the musculoskeletal system, I had her turn her head back and forth, up and down, and shrug her shoulders. This indicates to me that cranial nerve is intact. Then moving on to cranial nerve 12, the hypoglossal nerve, I'm going to have her stick out her tongue and move it side to side. And she is able to do that, so the cranial nerve 12 is intact. Next, I'm going to assess her muscle strength, since I already assessed the size and tone with the musculoskeletal assessment. Muscle strength, I'm going to have you grasp both my fingers. Strength is strong and equal. Don't let me push your hands down. Okay, on your feet. Press down against my hand. Okay, and pull up. Bilaterally, upper and lower extremity muscle strength is equal and strong. Then we're going to move on to assess cerebellar function, which tests balance and coordination. And the first test I'm going to have the patient do is have her hold her hands out and close her eyes, and then raise one hand with her eyes closed and return it back to the baseline. Okay, and do the other side. And she is able to do that adequately. Then I'm going to have her close her eyes and touch each finger. And she is able to do that adequately. Then I'm going to have her take her hands, close her eyes, and flip them back and forth. And she is able to do that without any difficulties, indicating that her cerebellar function is intact. Next, I will move on to sensory. My patient was able to feel me touch her lightly, which indicates no need to initiate pain and move centrally, as touch was initiated peripherally. Then I'm going to test her sensory perception of position, and I'm going to do so by having her close her eyes, hold out a finger, and tell me which direction I'm moving your finger.
That way.
Okay.
Oh, that way.
Okay. And position is intact. Next, I'm going to have check her stereognomos to see if it is intact. And I'm going to do this by having you close your eyes. I'm going to place an object in your hand, and I want you to identify it for me.
Coin.
Correct. And next, I'm going to see if she can detect me drawing an object on her hand to properly identify this sensory object.
Circle.
All right. And all are intact with the neuro assessment.